My name's Tammy. I am the Perioperative Manager here at Northern Inyo Hospital in Bishop. So our unit runs the surgeries, which includes the 3 ORs. And then we also have Sterile Processing in there, which supplies all the instruments for surgeries, as well as all the clinics. And then across the hall, we have the rest of the perioperative unit, which includes Pacu, pre-op, infusion. And we also do wound care here, which is down in DI. So in the pre-op area, we get patients ready for surgery. And then in the Pacu, which is the post-recovery area, so after your surgery, you recover in there with the same nurses, which is nice, so you'll be comfortable with them. And then we also do infusions in there. So all kinds of infusions, so we help the community a lot in that way. Our OR staff is really diligent to the point where they are all watching each other. And if the sheet that's covering the patient, let's say we have drapes that cover the patients, if the little tip of that touches something that's not sterile, somebody sees it and they do everything over again because it's so important for infection control.
Northern Inyo Hospital has 3 OR rooms. This is one of them. They're all set up pretty much the same way. This room is used for multiple different types of surgeries that we do here.
This is the anesthesiologist command center, basically. Monitor vital signs, give gases. This is the process for medications and holds all their supplies. This is kind of the bread and butter for an anesthesiologist.
The room 2 houses our Da Vinci robot. And then we have the standard equipment in all the rooms. The cautery, the Neptune. This is our Olympus tower, which we use for our scopes, laparoscopic surgeries, cabinet of our supplies, and then we have the anesthesia machine and our Omnicell for our medications. So we have our sterile processing. This portion would be, we call it the dirty part, but that's where everything gets like their first cleaning. And then this is the washer. So equipment, once it's hand cleaned, it goes in this machine and then it'll actually come out the other side to where it gets sterilized.
So you go to your surgeon, you find out you have to have surgery. You don't want to have surgery. There's a physician that talks to you separate from your surgical physician, which is nice, and they can give you information to maybe calm you if you're still worried. One of our periop nurses calls 2 days prior to your surgery, and you can voice any of your concerns to them. I think it's information. Most people are missing the information part, so they can ask any question that they might have, and the nurse will either have the information for them or will be able to provide information after they get it, and they will call that patient back. And that usually solves most of the problems of the fear. And then of course they get here and all of our nurses are so great at calming patients down.
So this is the Pacu. This is where we bring our patients to recover from surgery. We bring them here and then we keep them anywhere from an hour to 2 hours until they're ready to go home. For some surgeries, we bring them up to the med-surg floor and they get watched for a couple days. So we monitor, we got the monitor, we got all the supplies here, we've got the emergency supplies, and we've got the stethoscope and the suction supplies. So everything we need for recovery is here, easily accessible. The patient needs it, and we bring the patient's family here so they can hang out with them, and yeah.
Yeah, this is our rescue equipment here in the periop area, so that's our malignant hypothermia cart, which is a super rare thing that happens after a procedure, but we have it right here in case that starts to happen. We monitor the patients for that always. And then this is our crash cart. So if something started to happen to the patient, we have this right next to the bays where they're recovering. The patient comes for screening for something, like in DI perhaps, and then they see their physician again who's gone over that. And then maybe they need a procedure to check whatever might have been found in a screening, and then maybe they need surgery, or maybe you've hurt yourself climbing or skiing, and then you might come see our ortho guys and have a surgery there, and then after that you go to recovery. We come see you come from home, we do pre-op, and then you come to our Pacu, And then if something else happens where maybe you need an antibiotic or chemotherapy, we would then, be the same staff doing the infusions for the community as well, and wound care and along the same lines. You get bit by a dog, you fall and hurt yourself, you have a wound that's chronic and you've been going out of town for a long time, we have the service here and you can actually be here and recover at home. With all of our services, we offer so much. I think our hospital, what makes it so special is we all live here, so we are part of the community. Like I grew up in Mammoth and then I went to school and was a nurse and I worked in a bigger hospital and I finally got to come home and I work here now and I get to work with all these fantastic people. Another really cool thing is all of us, I like everybody I work with. It's very uncommon at other hospitals, I have to say. And our mission statement is one team, one goal, your health. So we're part of the community, we're here to help you, and you get to go home after you see us. Thanks for watching this healthy lifestyle talk, and thanks for letting me and my fellow staff show you a little bit about what we do here at Northern Inyo Hospital in Bishop.